what do you foresee as the future of personalized medicine oncology when sequencing the entire human genome will cost less than $1,000, which seems to be a price point that everyone agrees on, and probably will happen in the next few years?
Even sooner
How will that impact drug development for multiple myeloma, for example?
Everything will move faster when we can get more data. Of course, as Kathy pointed out, the informatics to manage all of that and make sense of it all is critical, and we certainly are building that type of infrastructure. But the more we can understand, the better. And it's really that genomic data that's going to enable it. But of course, the patient owns that data. No company can access it without patient permission. So our job is to help patients understand why it could be extremely valuable to both have the data, but also, whether it be through a third party, an academic institution, however it's done, to be able to share that data, anonymized, but within a much broader database, because that's the only place that we can truly get power in the data.
I think there's two elements that are changing healthcare dramatically. One is that it's becoming much more efficient to be able to do the genomics on these patients, but the second is social networking. And you know, the whole world has changed dramatically. So I have patients that literally go on Facebook and they'll say, hi, I'm a fellow, not a fellow myeloma patient, I'm a fellow 414, or I'm a fellow syngeneic transplant. And this is the world as we're going to see it. There will literally be a Facebook of oncology targets where patients are talking to each other. And we see this all the time where patients will call and they're newly diagnosed or something's happening with them and they have bone disease or they're highly fatigued. They only want to talk to patients that look like them. And they want to get into, you know, if they have a 414 or something, deletion of 17, they only want to talk to patients that have that same genomic aberration. So you see how we're going to start shifting patients to the right drugs, the right trials, because social networking is out there, and the genomics being efficient, we're going to start to have more and more data. I think the greatest roadblock is going to be how quickly we can build the systems, the IT systems, and how many people are going to be able to understand all of this data and really be able to help us do something with it quickly. Because it takes a certain skill set to be able to look at all of that and understand where we go clinically from that information. And how do we design new and innovative trials that will, you know, show that there's unmet medical need in a certain area and we need to move the trial and get FDA support faster. The whole world is changing overnight.